Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, over the past few months, I've noticed that my breathing has become more difficult, particularly when I'm lying down. It's not just the shortness of breath, but also the anxiety that comes with not being able to breathe easily. Mornings are the worst. I cough up hard, crusty sputum, which seems to be worse than before. I think it might be related to the COPD, but this feels different, almost like there's constant postnasal drip making it worse.
I understand your concerns. It's important to look closely at the changes in your symptoms, especially the sputum you're describing. Have you noticed any specific triggers or patterns that might be contributing to this exacerbation?
Not particularly, doctor, but I've been feeling like the air just isn't moving freely, and it's stressful. Plus, there's this issue with my stools. Lately, I've seen blood in them, bright red blood. It happened again just a few days ago, and honestly, it's quite alarming. There was about a quarter cup of clotted blood, and it's happened more than once over the past few months.
Have you experienced any pain or discomfort that accompanies these episodes of bloody stools?
No pain, which is strange. No discomfort when wiping either. I've been really worried about what it could mean, considering my age and the fact that I'm on Humira for my rheumatoid arthritis. I know it can mask symptoms of more serious conditions.
Right, that's a valid concern, especially with immunosuppressive medications like Humira. And regarding your urine, has there been any change in the frequency or any pain when you urinate?
No pain or change in frequency, but the odor is quite strong and the color is much darker than usual. It's been like this for a few months. I haven't really discussed this in depth with anyone until now.
Thank you for sharing that. It's important we look into all these symptoms comprehensively. Now, regarding your respiratory symptoms, what treatments have you been on recently?
I've been on antibiotics and prednisone, which seemed to help initially, but the relief is short-lived. Once I stop the medications, the symptoms come right back. We talked about maybe needing another chest x-ray and perhaps revisiting my steroid use. I'm also using a mucolytic to manage the secretions.
It sounds like you've been managing a lot on your own. We'll need to reassess your treatment plan, especially in light of these recurrent and worsening symptoms. Have you needed to use the emergency room for any of these issues recently?
No, not recently, but it's been mentioned that I should consider it if things get worse before I see my pulmonologist again.
I appreciate you keeping that option in mind. Based on what you've described, let's go over the findings and plan moving forward. Your breathing difficulties, especially with the production of hard sputum, suggest an exacerbation of COPD, potentially complicated by postnasal drip. The presence of bloody stools, particularly without pain, is concerning and warrants further investigation to rule out serious conditions like colorectal cancer or complications from hemorrhoids.
That makes sense, doctor. What are the next steps then?
Firstly, we'll order some blood work to get a current picture of your overall health. I'd like to add a fecal occult blood test, given your symptoms. We'll also start you on a Z-Pak to manage any bacterial infection that might be exacerbating your COPD, and continue with a steroid to help reduce inflammation. A chest X-ray is crucial to see if there have been any changes since your last scan.
And the urine and stool issues.
For your urine, considering the dark color and strong odor, a more detailed urinalysis and possibly a renal function test might be necessary to rule out any underlying kidney issues. As for the bloody stools, scheduling a colonoscopy will be crucial. Given your history and current medication, we need to be thorough.
All right, I understand. It's a lot, but I'm glad we're looking into everything.
Absolutely. It's important we address each concern. Please monitor your symptoms closely. If you experience any worsening, especially with your breathing, or if you have more episodes of bloody stools, visit the emergency room immediately. We'll review everything in detail when you come back with the test results. Is there anything else you'd like to discuss today?
No, that covers all my current concerns. Thank you for your thoroughness, doctor.
You're welcome. Take care, and I'll see you soon with your follow-up results. Remember, immediate attention is necessary if your symptoms escalate before our next visit.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I wanted to talk more about this nerve pain I've been feeling. It's like a burning coal on my legs, and it just doesn't go away with the gabapentin I've been taking. I've tried to stick with it because I know it needs time to work, but it's been tough.
I understand that must be very uncomfortable for you. Can you tell me how long you've been experiencing this nerve pain and how often it occurs?
It's been a few months now. It happens mostly at night, and that's what really bothers me. It interrupts my sleep. I'm tired all day because of it.
That sounds quite challenging. We talked about possibly increasing the gabapentin dosage to see if that provides you more relief. Have you noticed any side effects from the medication so far?
Not really any side effects, but it just doesn't seem to do enough for the pain. About my other concerns, I've been monitoring my blood sugar levels at home like we discussed. The readings have been better, mostly in the recommended range.
That's good to hear. It sounds like the adjustments we made to your diabetes management are working. How about your blood pressure? Have you had a chance to check it regularly at home?
Yes, I check it occasionally. The readings vary, but they generally seem to be lower than before. I've been trying to keep a record to show you next time.
That would be very helpful. Keeping a track of your blood pressure will help us manage your hypertension more effectively. Now, you mentioned a recent fall. Can you describe what happened?
Oh, it was nothing serious. Just a little incident where I got pushed accidentally in a crowd. My knee got sore, but it's nothing new with my knee troubles. However, I didn't injure myself badly.
I'm relieved to hear it wasn't serious, but we need to be cautious, especially considering your mobility issues. Speaking of which, we had scheduled a colonoscopy, but you mentioned some concerns about going through with it.
Yes, that's right. It's just too much for me to handle right now with the wheelchair and all. Getting to appointments is hard enough, and preparing for a colonoscopy feels overwhelming.
I understand your concerns. Mobility issues can indeed make such procedures more challenging. We'll revisit this topic and explore what support we can provide to make it more manageable for you.
Thanks, doctor. I appreciate that. Also, I've been thinking about what we discussed regarding smoking. I know I should quit, but it's hard. I'm not ready to make that step yet.
Quitting smoking is a significant challenge, especially with everything else you're managing. Whenever you're ready, we can discuss support options to help with cessation. It's never too late to benefit from stopping smoking.
I'll think about it, doctor. It's just a lot to deal with right now.
Of course, take your time. Now let's summarize today's discussion and plan. Your recent lab results showed your LDL cholesterol is at 142 milligrams, which is high, and your HDL is 55 milligrams daily, which is quite good. Your fasting glucose level was a bit high at 158 milligrams, but it seems you're managing it better now with the home monitoring. Your kidney function tests indicate mild impairment with a creatinine level of 1.2 milligrams per deciliters and an estimated GFR of 59 milliliters per 3 meters squared. Your liver function is stable, and the recent EKG showed no issues with your heart rhythm.
That's a lot of information, doctor. What do we do next?
Given your concerns about nerve pain, I will increase the dosage and monitor your response. We should continue with the home monitoring for your blood pressure and blood sugar. I would also like you to come in for a checkup in a month, and we'll see if further adjustments are needed based on your lab tests and overall progress. We'll also continue to discuss and support your challenges with mobility, smoking, and overall health maintenance.
Sounds like a plan, doctor. Thanks for helping me keep track of all this and for understanding my concerns.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
It's good to see you today. I understand you've been having trouble sleeping. Could you describe what's been happening at night?
Yes, I've been struggling with falling asleep and staying asleep. I often wake up feeling tired.
That sounds difficult. There are several treatment options we can consider. One is cognitive behavioral therapy for insomnia, which has been very effective for many patients. It involves regular sessions aimed at changing sleep habits and scheduling.
I've heard about that. What about medications?
Medications are another option, such as melatonin or prescription sleep aids. However, these are generally recommended for short-term use. We can also look into lifestyle changes that can help, like adjusting your bedtime routine or diet.
I'd prefer to start with non-medication options if possible.
Absolutely, that's a wise approach. Let's start with some behavioral adjustments and consider therapy incorporating some relaxation techniques. We'll schedule a follow-up to monitor your progress.
Now look at question 26.
Good morning, everyone. Today I'll be discussing the necessary precautions our nursing staff should take when administering vaccinations. It's crucial to ensure the safety of both the staff and the patients. First, always verify the patient's medical history for any allergies or previous adverse reactions to vaccines. Next, proper storage of vaccines is vital. They must be kept at the recommended temperatures to maintain efficacy. Also, always use aseptic techniques to avoid contamination. This includes hand hygiene, wearing gloves, and using alcohol swabs. Finally, be observant of the patient post-vaccination for any immediate reactions. It's important to have emergency equipment readily accessible in case of an anaphylactic response. Thank you for attending, and please make sure to review these guidelines regularly.
Now look at question 27.
How are you feeling today? I know these first few weeks as a new mother can be quite overwhelming.
Honestly, it's been really tough. I feel exhausted and sometimes quite emotional.
That's completely normal. Many new mothers experience feelings of sadness, fear, or anger. It's important to talk about these feelings and not to keep them bottled up. We have support groups and counseling services that can help you through this time.
That sounds helpful. I sometimes feel so alone with all these feelings.
You're not alone, and it's okay to ask for help. I can connect you with our support group where you can meet other mothers experiencing similar challenges. It's a safe space to share and learn from each other.
Thank you. That would be really great. I think talking to others who understand might help a lot.
Absolutely. I'll arrange for you to join the next session. Remember, taking care of yourself is just as important as taking care of your baby.
Now look at question 28.
Welcome everyone. Today's training is focused on culturally appropriate care, an essential aspect of our practice here at the hospital. Recognizing and respecting our patients' diverse cultural backgrounds can significantly affect their recovery and satisfaction. First, it's important to be aware of cultural specifics that might influence medical decisions. This includes dietary preferences, language barriers, and traditional health practices. Always ask open-ended questions to better understand their needs. Additionally, try to use language services when necessary to ensure clear communication. Misunderstandings can lead to decreased care quality and patient dissatisfaction. Lastly, always be respectful and patient. If you're unsure about something cultural, it's okay to ask the patient or their family. Showing respect can build trust and improve healthcare outcomes. Thank you for your commitment to providing respectful and culturally sensitive care.
Now look at question 29.
Nurse, I'm concerned about Mr. Johnson's decision to leave the hospital early. He's still not stable and could risk complications.
I understand your concerns, Doctor. He's been very adamant about leaving, citing personal reasons. Perhaps we can arrange a meeting to discuss these with him?
That's a good idea. We need to ensure he understands the risks and the benefits of staying for full treatment. Could you facilitate this meeting later today?
Absolutely, Doctor. I'll set it up and make sure to express the importance of his health and our recommendations clearly.
Thank you, Nurse. Let's prepare some materials he can take home, just in case he decides to leave. It's crucial he knows when to seek immediate medical attention.
I'll prepare those and also contact his primary care provider to alert them of the situation. We need to ensure a continuum of care.
Now look at question 30.
Good afternoon, everyone. Today I'm here to talk about our upcoming hospital accreditation process. Accreditation is a tool that ensures public accountability and continuous improvement in our hospital. The process involves evaluating our services against established standards of quality and safety. External reviewers will visit our hospital, observe our operations, and speak with staff and patients. To prepare, we need to review our policies and procedures to ensure they are up to date and fully implemented. This includes everything from infection control measures to patient privacy protocols. I encourage everyone to participate actively in the preparation. This is an opportunity to identify areas for improvement and to showcase the excellent care we provide. Let's aim for not just compliance, but excellence. We will be organizing training sessions and review meetings in the coming weeks. Please make sure to attend so you are fully informed and ready for the accreditation visit. Thank you for your hard work and dedication.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we'll be delving into an intriguing topic that has garnered significant attention in the healthcare sector, particularly in the context of the COVID-19 pandemic. We're examining the impact of labor unionization in healthcare settings, specifically in nursing homes, and how this correlates with patient outcomes. This conversation builds on recent research published in Health Affairs, which found that unionization in nursing homes was associated with a 10% lower mortality rate among residents during the early months of the COVID-19 pandemic compared to non-unionized homes. Let's explore a case study that reflects these findings. We'll look at the experience of a fictional nursing home, Pine Grove, which we'll say is located in New Jersey. Pine Grove has been unionized since 2018 and faced the COVID-19 pandemic with its union workforce. According to the data from Pine Grove, had significantly lower rates of COVID-19 infection and mortality among its residents compared to nearby non-unionized facilities. Now, what could be contributing to such outcomes? First, let's consider the role of personal protective equipment, PPE. In unionized settings like Pine Grove, the presence of a union often ensures better access to PPE. This is crucial, as PPE is a key factor in preventing virus transmission in healthcare settings. The union may negotiate more aggressively for proper PPE and safer working conditions, which directly impacts the health and safety of both staff and residents. Another aspect to consider is staffing ratios. Unions typically advocate for lower patient-to-staff ratios, which not only reduce workload and burnout among healthcare workers, but also improve patient care and oversight. With more staff available, residents in unionized facilities like Pine Grove receive more individualized attention, which can be critical in managing and preventing the spread of infections like COVID-19. Training and protocols might also play a role. Unionized homes are likely to have more structured and rigorous training programs for their staff regarding infectious disease control and emergency response. This ensures that staff are better prepared and more knowledgeable about handling such crises effectively. Financial resources also come into play. While unionized facilities might sometimes have higher operational costs due to better wages and benefits for staff, these investments in human resources lead to better care delivery. In our case study of Pine Grove, the investment in staff well-being is reflected in the quality of care provided to the residents, ultimately contributing to better health outcomes. Now, examining the broader implications of these findings, it's important to discuss potential policy shifts. If consistent data supports the benefits of unionization in improving healthcare outcomes, policymakers might consider regulations that encourage or support unionization in healthcare settings, or at least ensure that some of the protective factors associated with unionization are universally implemented. Additionally, this research can inform healthcare administrators and leaders about the potential benefits of adopting certain union-like policies, such as improved PPE access, better staffing ratios, and comprehensive training programs, regardless of actual union presence. However, it's critical to acknowledge the limitations and potential confounders in studies like this. Factors such as the overall quality of the facilities, the socio-economic status of residents, and pre-existing health conditions can also influence outcomes. Moreover, the broader political and economic environment can impact how policies are implemented and adhered to in different states and regions. The case of Pine Grove serves as a compelling illustration of how unionization in healthcare, particularly in nursing homes, could be a significant factor in improving patient outcomes during pandemics. This adds an important dimension to our understanding of healthcare management and labor relations, suggesting that the benefits of unionization might extend beyond traditional labor concerns to directly impact patient care and safety. This discussion opens several pathways for further research and policy development. As healthcare continues to evolve,
particularly in response to global health emergencies, the role of labor unions could become a pivotal point of study and consideration in the quest to enhance public health outcomes.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to today's Healthcare Forum. Today, we're diving into an intricate discussion on the updated guidelines from the U.S. Preventive Services Task Force regarding the use of aspirin for primary prevention of cardiovascular disease. As healthcare professionals, it's imperative we understand these nuances to better guide our patients. Let's start with a case study that exemplifies the complexities we face in clinical decision-making. Consider John, a 58-year-old male with a history of hypertension and hypercholesterolemia, but no cardiovascular events to date. His 10-year cardiovascular risk, calculated using the ACC-AHA risk calculator, stands at 12%. John has been proactive about his health, often inquiring about preventive measures, including the use of aspirin for heart attack prevention. According to the latest USPSTF guidelines, the recommendation for initiating low-dose aspirin in adults aged 40 to 59 years who have a 10% or greater 10-year cardiovascular risk should be an individual decision. This is categorized as a grade C recommendation, implying that there is at least moderate certainty that the net benefit is small. It's a nuanced position that requires us to weigh the benefits against potential harms, such as increased bleeding risk. In John's case, the decision involves a detailed discussion about his specific risk factors, his personal values regarding health interventions, and the current evidence base. It's important to convey that while low-dose aspirin could potentially reduce his risk of myocardial infarction, it also increases his risk of gastrointestinal bleeding and hemorrhagic stroke. Recent studies, including those mentioned in the 2018 trials such as ARRIVE, ASCEND, and ESPRIT, provide us with evidence that in similar populations, the reduction in cardiovascular events was minimal and closely matched by the increased risk of bleeding. Furthermore, these guidelines emphasize the importance of initiation rather than continuation. For patients like John who have not started on aspirin, the decision is even more weighted towards caution due to the age-related increase in bleeding risk as one approaches 60 years. This brings us to another critical aspect of our discussion, risk communication. Communicating risk involves more than just providing statistics. It requires understanding the patient's health literacy, expectations, and fears. discussing how a 1% reduction in risk of myocardial infarction might translate into real benefits versus a similar increase in the risk of serious bleeding, requires clear, empathetic communication and should be tailored to each patient. Let's also consider the psychological and ethical dimensions of such decisions. Some patients might prefer to take any measure that could potentially extend their life, while others may prioritize quality of life without the burden of daily medication or the anxiety over possible side effects. This is where shared decision-making comes into play, integrating John's values and preferences into the final clinical decision. In John's scenario, if he expresses a desire to do everything possible to prevent a heart attack, despite the close balance of risks and benefits, we might decide to initiate low-dose aspirin while closely monitoring for any signs of bleeding. On the other hand, if he is more concerned about the potential side effects than the marginal benefit, we would likely advise against it. This approach not only aligns with the USPSTF recommendations, but also respects patient autonomy and individual preferences. It's about providing personalized care that considers all facets of an individual's health profile and personal views towards medical interventions. The decision to initiate aspirin for primary prevention in adults like John is complex and must be approached with a comprehensive understanding of both the scientific evidence and the patient's perspective. It's crucial that we remain adept at navigating these discussions, ensuring that our patients make informed choices that reflect their best interests according to the latest evidence and guidelines. Thank you all for your attention. I look forward to your questions and to a robust discussion about how we can continue to improve our practice in light of these evolving guidelines.